So psychotherapy works. Psychoanalysis, as one of the psychotherapies, it works. But we have 1,200 and more kinds of psychotherapies that work. And it is quite counterintuitive to think that there is 1,200 ways in which psychotherapy can work. I mean, how many different types of interventions and things can actually someone do? They might have something in common, and psychologists have been trying to find that thing in common that every psychotherapy that works has. The way of studying this, it's called the Dodo bird problem, or the Dodo bird verdict, in which it's taken from the Dodo bird character in Alice in Wonderland, in which many animals in this world have like a race, and they kind of all get to the finish line at the same time, and the Dodo bird goes like, so everyone won, everyone has prizes. But that is a final kind of statement, but we should know why everyone has won, why so many psychotherapists that in paper look really different from each other, they work. And the first kind of response we can give to that is the fact that all the psychotherapists have some sort of a relationship involved. So some that we call the therapeutic relationship, the therapeutic alliance is also called, in which a psychotherapist and their patient create a relationship of work and an emotional relationship, and that the way that that relationship is managed seems to be therapeutic and seems to cure people from depression, anxiety, eating disorders, psychosis, etc. And there are different ways to study this kind of relationship. And actually, if you measure it by asking both the therapist and the patient after a session, let's say, about the quality of the relationship they think they have with the therapist, or if you ask the therapist, with their patient, the higher they rate this feeling of having a good relationship, the better the patient actually feels if you measure it at the same time that symptoms, let's say. So, okay, it's the relationship. The relationship seems to be the most important thing in psychotherapy. It doesn't matter if it's a psychoanalytic psychotherapy, a cognitive behavioral one, a Skinner one, Pavlov, etc. What works seems to be the relationship first and foremost. But how? Why a relationship works, and why as humans we are kind of programmed in order to change for the better just by having a relationship. And the way of answering this question on what is the mechanism through which a relationship actually is therapeutic, just a relationship between humans, nothing really magical, why is it therapeutic? And to answer that question, there are many different ways. We don't know really, but one of the most sound theories about it, the most believable theories about it, and that is very new, so slowly is having more and more evidence backing it up, is that as humans we seem to be pre-programmed, or we have evolved since the beginning of our species, that relationships are important not only because of survival, as you can see like in attachment, in which a mom comes to a baby and gives him food, etc., etc., but we also are programmed to just exchange information. We get some sort of a pleasure, and also we get like health by receiving and transmitting culture. Culture, it's social information in general. So how to behave, what things are true, what things are not true, what are traditions, what are not, etc., etc. We seem to be programmed to do that, because if we think about how human beings as a species have been evolving, yeah, we have genetic evolution in which like we are taller than some millennia ago as a species. We don't use our appendix anymore, for example. We have the biological evolution, the Darwinistic one, the one everyone knows. But in the case of humans, we also have a second line of evolution, which is called cultural evolution. And this has been developed since like prehistory, like the late Pleistocene, and what happens is, as a species, we're really good at, we saw this before, at knowing what the other one's thinking, knowing what I'm thinking, trying to predict what the other response is going to be to my own actions, etc., etc. And once we develop that, we are able to trespass information to each other. But more importantly, we are able, because we know what the other is thinking and feeling, more or less, we know if the information we're receiving is true or not, and what are the possibilities for this to be true. This seems to be really, really, really far away from psychotherapy, but it's not, because the problem that most people have when they have a psychopathology, a personality disorder, a depression, etc., etc., all the problems we can count in the work of the psychologist or the psychoanalyst, they involve problems with relationships, with not taking any benefit from being surrounded by people who like me, who love me. My family, they like me and love me, but somehow I feel sick anyway. And then my relationship with those people don't work very well. It does happen that most people who have a problem, especially a severe problem, and they go to a psychologist to try to fix it, they've had a very adverse early years, normally. So they had maltreatment, for example, or abuse, or just parents who were not there, so some neglect. Obviously, everyone has more, everyone has less of that. But what happens is, like, those first years are very important for the development of mentalizing, as we saw, but also to develop the capacity of thinking that what people around me want for me is good, so what the information that they give me is true. It's very weird, because we think, like, in tribes, when we were like just evolved out of primates, you can think that maybe one tribe would want to lie to the other tribe in order to have a benefit, of the other tribe to do something wrong, and so we have a benefit as our tribe. So we developed also like a way that is like our standard way of being, in which we don't believe anything unless someone shows that they recognize us as agents. So basically what they're doing is having our mind in their mind, and for this I'm throwing back to what is mentalizing. Because if we feel mentalized by other people, we tend to believe what these other people say. And this is really, really useful if you're a politician, for example, or a person who does marketing. As long as they, for example, treat you by your name and say, I understand what you're going through, even if it's a lie, you are gonna be more likely to believe whatever they're saying. And you can listen in different, like, politician speeches, how they go like, I understand what you're going through, and we are going through this. They put themselves in the same plane as you are, even though they're talking to thousands of people. But if they make you feel that you're one, that you're special, you will open this channel to believe things. And if the people who are around you want something good for you, you can start benefiting of these relationships, and these relationships seem to be therapeutic. So, okay, it's the relationship with the therapist that makes therapies work, but actually is the relationship with the therapist as a model relationship that will allow the patient, once they're out of my office, to do the same and to have a good relationship with their partner, their co-workers, the people who are around them, and start benefiting from people who are benign to me. I mean, if I do psychology and I do it really well, and psychotherapy that's really good, to a person who, as soon as they go back home, they get into an environment of abuse and violence and war or heavy drug consumption, my therapy is not going to work. So what I need for a good psychotherapy is creating a relationship that could open this channel to believe in the rest of the people outside therapy. And that seems to be the most important bit in psychotherapy. The therapeutic bit in psychotherapy doesn't have to do with the things that you discover while you're sitting in my office. It's like how the things that you discover while you're sitting in my office allow you to change the way you relate to people around you outside my office. You're not going to be in my office most of your time, and hopefully you're not going to be in my office forever. So I need a way for you to show you that if I treat you as a psychologist, I treat you as a patient, like a person, an individual person, and I validate what you feel, and I understand and I show that I can have your mind in my mind, you're gonna open this, what we call epistemic trust. So this capacity to learn from a good environment. And I'm not gonna give you the good environment in my office. The good environment, I can help you create it if you have a bad one, but the idea would be that what you learn in my office, you apply it with the rest of your relationships, and that is therapeutic.